Vakratunda Mahakaya Suryakoti Samaprabha Nirvignam Kuru me Deva Sarvakarishu Sarvada. Om Shanti Shanti Shanti.
Sai Ram, everyone. Sai Ram. My dear pranams to our dear Bhagwan Sri Sathya Sai Baba, who is always protecting us, always guiding us, and who is ever in our presence wherever we are. Whether it be in our homes we are praying, whether it be in our centers that we are praying, and whether we are doing virtually online stuff. So Swami, please bring your presence into this meeting and guide us through the next hour. Sai Ram, everyone. Thank you for joining us today. We are now at a transition again in this past journey of 18 months where things are changing. And so the medical community is here today to just bring you some knowledge, some information, and some suggestions around the changing landscape over the next few months as things start to reopen across the country. As you know, we've tried to guide centers towards closing when we had to close back in March of last year, and through all those different stages that have happened through opening and reclosing. And as you all know, it's been a little bit of a roller coaster. So today we thought that before, as centers as provinces reopen over the next few months, that we would bring you some information around a COVID update, as well as understanding a little bit of the psychology of what is important to take into consideration as we do reopen, and talk a little bit about the leadership that might be necessary. So I'd like to introduce to you my two left hand and right hand we've been working tirelessly together. Dr. Avi Ramaswaru. Avi has been a GP in practice for the last 6 years. He's worked in a community which has a lot of COVID, and so he's very well versed with that and is kept up to date with all the different variants and different things that are happening with COVID. And he's going to be presenting our COVID update. And thank you, Abby, for such hard work and your diligence through this whole process and looking at all the guidelines for reopening and helping us reopen with different centers and going through all the plans. So he's been an amazing asset in the committee. And then we'll have Sister Patricia, who has been involved in healthcare for 28 years and in advanced education for 12 years. And she's joining us to talk about a little bit of the psychology around transitions and around COVID and what happens when we have stressful situations and what it's like to transition with that. And then certainly bring her perspective around resilience training. She's also a yoga teacher. So she brings a wealth of information. Patricia has been extremely helpful in keeping us all on track, has been bringing great input and feedback to the medical committee to provide the stuff that we've given to you. And then I will close up with a few closing slides on leadership. So I hope this session is very useful for you, and we have left time for Q&A. So that will be open for you for Q&A, and as we always have some email questions as well. And the last thing is just to remember that the medical committee is now here really to help you transition and answer questions. We obviously will not be doing, as things open up, there will not be such a need for us to monitor everything, but really just our goal here is a support, and also here to help the organization in any of the challenges that they may have through the transition. So without further delay, Brother Avi, thank you. Sairam.
Sairam, thank you, Nishi. I know that Brother Siva wanted to say a few words before we start. I noticed he's logged back in. Would you still like to say a few words, Brother Siva?
Just a couple of words. Can you hear me now?
Yes, we can.
Oh, perfect. All right. Saram, everyone. And thank you so much. My humble pranams to Bhagawan. And we have an excellent team here, Dr. Avi and Sister Patricia, as well as Dr. Nishi, who is going to guide us through. All I wanted to say is that I know that things are looking much, much better than what it was last year during this period of time. And the only thing I like to take this time is to thank all of you leaders within your own Sai centers that have done an incredible job over the last year in supporting your centers through all, incredible Zoom platforms with bhajans and programs for children. And so we just want to take this time to thank you and show our gratitude. It is, I'm sure it's kind of an anxious feeling of wanting to come back together. And so I know everyone is very anxious and wanting to be able to come back to the centers, but at the same time, it's a little apprehensive because we've been 1 year out being very socially distanced, and bhajans is quite a crowded room of very enthused devotees. But nevertheless, we would want to see us come back together, and I'm going to let Dr. Avi lead us through that process. And so thank you so much.
Thank you, Brother Siva. I'll just begin sharing my screen here. Okay. Okay. So Sairam, everyone, thank you so much for coming out this evening and joining us on this Thursday night. Can you all hear me? Yeah, okay. So today, Sister Nishi, Sister Patricia, and I put together a presentation, to orient you guys all to the changes that are happening right now with the coronavirus situation, how we intend on having our centers reopen, and also some psychology, transition, and leadership topics around the coronavirus and how it pertains to the impacts on our Sai centers. So I'll start off with some perspectives about COVID-19. The first case of COVID-19 in Canada was reported on January 25th, 2020 at Sunnybrook Hospital here in Toronto. And since then, as Sister Nishi said, it's been quite the roller coaster, lots of ups, lots of downs certainly, and lots of adaptation. We've certainly seen a lot of loss of lives, limitations of healthcare resources, untreated chronic disease, which we're now starting to see in primary care, misdiagnosis, things that weren't addressed over the year or more than a year, impacts on the economy, mental and spiritual health, and as well as possibly most importantly, isolation from our Sai community. However, this has provided an excellent opportunity for centers to learn and adapt. Centers have learned how to deliver services remotely, things like recorded bhajans, SSSE, study circles were all modified for online access. Several projects and continued essential services like blood donations were able to continue through the pandemic. The COVID-19 pandemic has also given us a time for introspection, the opportunity to learn about ourselves and work on spiritual development, somewhat indirectly through the removal of external distractions in our lives. And also there have been positive environmental impacts of COVID, improved air quality, emissions, and less water pollution, and so on. There are several studies that show that these changes may actually assist with the restoration of our very damaged ecological system. From a little more of a scientific perspective, what we've learned about the coronavirus over the year plus, we know that COVID-19 transmission occurs primarily through respiratory droplets and aerosols, which are airborne particles. When an infected person coughs, sneezes, sings, shouts, or talks for that matter. There's also been a lot of increasing evidence recently about the airborne spread of coronavirus, which early on in the pandemic, it was more so thought to be droplet spread, but now there's increasing evidence of airborne spread of this virus. And it's prompted us to take action to improve our indoor air quality, ventilation, and filtration systems. There have been surface transmission documented. However, it's not thought to be a very common way of how this virus spreads. We also know, particularly relevant to our PSI centers, is that some people are more likely than others to become very ill with coronavirus, particularly older adults, individuals with medical conditions, such as diabetes, dyslipidemia, hypertension, which are all illnesses that are very common in the South Asian population. And pregnant women and postpartum women are also more likely to become ill. So this is particularly important when we think about the context of our PSI centers, because the populations that attend our centers tend to come from this group. So we have to always factor that in. Recently, the hot topic, or one of the hot topics, has been the variants of concern. As we know, coronavirus has changed a lot. It's mutated over the past several months. And these variants come with even increased risks to younger and healthier individuals. So talking a little bit about some of those hot topics, the variants of concern are filling up the news headlines recently. There are currently 4 variants that have been identified in Canada. And these are mutations in the original virus. So the virus has a protein called the spike protein, which it uses to get into our cells. And the shape of this spike protein can change as the virus adapts. And it can either make the virus more contagious or less contagious. And in the case of the Delta variant, which is the most contagious variant yet, and it was the variant that was first identified in India, and is currently spreading across the world, and will likely soon become the dominant variant across the world. It's significantly more contagious than the original coronavirus. There's increased risk of transmission. They estimate that the original coronavirus would spread, if one infected person would potentially spread it to 2 other individuals during the course of their illness. The new Delta variant, they're thinking that number is closer to 4 or 5 people that can be infected from one infected person. Also, studies are ongoing which suggest that this variant may be more severe in terms of hospitalization and critical illness. And also there have been recent concerns raised about vaccine efficacy. Whether going forward, if the virus mutates further, will our existing vaccines still work? The preliminary evidence suggests that they will. However, more research needs to be done, and that needs to be documented more clearly. In terms of the vaccines, there are currently 3 vaccines in Canada. Most of you are probably aware. We have the mRNA vaccines, which are currently being produced by Pfizer and Moderna. And we have a viral vector vaccine that's produced by AstraZeneca. And of note, you may have seen in the news that AstraZeneca is no longer widely being distributed due to some concerns with its side effect profile. Now, we ask ourselves, what is the effect of vaccination on this pandemic? So this graph here shows us Alberta, cases in the ICU. And we see over time, the numbers have gone up and down with various waves. But what this graph shows us is that most of the cases currently are in the unvaccinated population. There's still a fair number of cases in those individuals who are what we call partially vaccinated or received one dose but not both. And there's a very small number of cases still in those who have received 2 doses or are fully vaccinated. This tends to tell us that the vaccine, it has been fairly effective in protecting those who have been fully vaccinated. You see this line here shows that at this point, this was when 50% of the population had 1 dose, and here was when 25% of Alberta's population had 1 dose. And this is a few days ago here. This is current up to a few days ago. It's important to know from this data that if you're not fully vaccinated, meaning you haven't received your 2 doses and haven't waited sufficient time to become immune, you're still not protected from coronavirus infections. And that has a role in helping us decide the timing of reopening centers and so on. We can also look at some data from other countries. There are some countries that are ahead of Canada in their vaccination process in terms of the percentage of their population which has been vaccinated. In particular, the United Kingdom and Israel have a larger percent of their population that's been fully vaccinated. And what we've seen recently is several of these countries are seeing increases in the number of cases, despite being further ahead of the curve in their vaccination process. And this is likely reflected by the new highly contagious Delta variant, but it's also reflective of the fact that not everyone is vaccinated fully, and not everyone is fully immune. Now, in terms of what this means for Canada, we may try to extrapolate from this data, and we may say that, while things are looking very positive now, and they certainly are, with provinces reopening in many ways, the pandemic is not likely to be over. We still may see future waves of infection, particularly in communities with lower vaccination rates. And we may see, going forward, cycles of relaxing and tightening of public health measures. It's not necessarily all going to be positive going forward. This slide summarizes kind of the big picture it creates an analogy here of a bathtub, and the water in the bathtub is the COVID-19 burden. And we see that the tap, which is filling up the tub, is affected by new variants of concern, which are more contagious and more serious. And as we relax public health measures, we expect the burden of COVID-19 to go up as well. On the other end of the bathtub, there's the drain, which helps lower the COVID-19 burden. And that's the things contributing to that are vaccinations, herd immunity, and tightening of public health measures, of course. And the goal here, metaphorically, is to prevent the bathtub from overflowing. We don't want to overwhelm the healthcare system, which has always been the goal of flattening the curve. So how has Canada decided to reopen things? Overall, our country has decided to implement a stepwise approach to reopening. And I've posted Ontario's roadmap to reopening. And Ontario is using step 1, 2, and 3. And those steps are being determined by the percentage of our population which has been vaccinated, not only with 1 dose, but with both doses, fully vaccinated. So as you see, as a larger proportion of the population gets vaccinated, public health measures progressively are relaxed. Progressing from currently Ontario is at stage 2. So, there's indoor gatherings with a small number and face coverings, and expanded outdoor gatherings. And then hopefully in the coming weeks, if cases continue to trend in a good way, that will move on to phase 3. And if vaccinations remain, the vaccination uptake remains high, things may expand further indoors. And again, these steps are not necessarily the same across every province. Different provinces have different phases and different activities that are covered in each phase. So this is just an example of Ontario. So what next? That's the question. So I think we need to take away from all this that there is light at the end of the tunnel. Certainly there is. As I mentioned before, the coming months may likely reflect frequent changes in public health guidelines. Lockdowns and restrictions may reduce or increase going forward. And what this means for our centers is that we must be prepared to adapt and keep up to date with the guidelines, which may look quite differently in each city and may be frequently changing. Reopening can occur gradually when centers, executives, and general membership are comfortable. And I think that's an important point for everyone to hear. You know, there's no pressure to reopen your center. It's something that each center has to think about, put the time and effort into reopening, designing a reopening plan. And then when your membership and your executive are comfortable, then you can proceed in moving forward. And also, the bottom line is always that centers must adhere to local public health guidelines at all times. How do we achieve this? So the medical committee, we've designed a cycle, a reopening cycle. And we'll be posting the slides, and this will go up into a PDF on our website. So you'll start up here with reviewing your public health guidelines regularly and regularly monitoring for updates to ensure that you are compliant. Now, one thing that we noticed was that it's often quite difficult to find the appropriate guidelines. Often, you know, there will be websites from your public health unit, but then they'll also have a PDF long form guidelines. And they may not always reflect the same information. And whenever there are discrepancies, you may have to get in touch with public health to answer specific questions. I'll use the example of Vancouver. When we met last week, sisters Nishi, Patricia, and I, we were looking at the Vancouver guidelines, and the main website said, you know, things were opening up without many restrictions, but their long form guidelines in the PDF document were not really up to date. They were 15 days old at that point. So it's important to track down the appropriate document, and you know, we are here to support you in doing so. If you have any uncertainty as to, you know, what the right guidelines are, we can direct you to the appropriate guidelines if you reach out to the medical committee. But once you found the appropriate guidelines, the next step would be to develop or modify, if you've already developed a reopening plan before, and reviewing that plan with your center executive. And the takeaway point from this is that having an official document for reopening, like a written document, is actually mandated by most public health units. And they may visit your center, they may contact your leadership and ask for a copy of this printed document for your reopening. So this is an important point for centers to note and to work on. Now, once you've developed this reopening plan by referring to your public health guidelines, the next step would be to inform the SSIO Medical Committee of your intent to reopen or any significant changes to your previous plan by completing this Google form that we have. And this Google form, a link will be found on our website. And this form, we are requesting that it is submitted, whether you're looking for input from the medical committee or not. We've touched base with the SSIO Canada executive and Brother Siva, and they are requesting that this document is submitted so that the executive committee overall knows that which center is reopening at what point. It will at least notify us that which centers have moved forward with reopening. The next step in that document is the SSIO Medical Committee. We are available for support as required. So if you have questions pertaining to your reopening plan, if you need, as I said, direction to the appropriate guidelines, you can definitely reach out to us. And on the Google form, there's a box for you to input your questions and to say whether you'd like us to review your reopening plan. Previously, we were reviewing every center's reopening plan. This time, because the reopening in each province will look so different, we're saying that if you're comfortable with your public health guidelines and you feel that you have a good understanding of them, you don't necessarily require quote unquote approval from us. However, we're always here to support you with any step of the process. Then, after these steps, you'll review your reopening plan with your center's general membership. And then once your general membership is comfortable, you can then reopen the center. And then certainly challenges will pop up. There may be barriers, there may be things you need to adapt and change as things go forward, and you will adapt to those challenges. And then it comes back to the first point, which is regularly monitoring for updates of the public health guidelines to ensure that your center remains compliant adherent to those guidelines. So this kind of summarizes our steps to reopening. If you guys have any questions, we will address them at the end of the presentation. Now I will hand the mic over to Sister Patricia, and she'll be discussing psychology of the pandemic. I think you're muted, Sister Patricia.
We still can't hear you.
And the same thing I think happened to me. Might have to log out and log back in.
Okay, let's we'll let Sister Patricia just rejoin our meeting. Just give Sister Patricia a moment to re-enter.
While we're waiting for Sister Patricia, thank you, Abby. That was an excellent presentation, and I think it really gave a great overview and also an understanding of the different steps that we do need to take in reopening. And I just wanted to highlight Brother Avi's comment that the guidelines are different from each province to province, and also each from municipalities. So City of Vancouver may be different from then BC itself. So very important to look at the right guidelines, and the long form will go through things like, how much capacity or not capacity of a building, or singing, or things that are quite specific, and sometimes they will bring it up and not. So we were also challenged at times to find the right form. So please do make sure that you are looking at the right form. And I think, Abby, we did ask that in your Google form, that when you submit that Google form, that you provide us a link of the website that you've used, so that we can just see that it's the correct one, and so there's no confusion.
Correct, yeah.
Okay, Sister Patricia, I think you're.
So Siron, can you hear me now?
Yes.
I feel like Verizon. Can you hear me now? Thank you. I'm just going to quickly go through some of what has been happening with the COVID or the pandemic. So over the past year and a half, we've experienced challenges that have never before been seen in our lifetime. News came in February 2020 of a deadly virus, but we didn't know how it was transmitted or what it would do. Information was spotty. There were conflicting statements from our experts. We were bombarded and still are with case numbers and a very dismal picture. On a global basis, we saw that the borders were closing. Citizens were being asked to stay home, to create a bubble, to mask, to isolate. Businesses were shuttered, jobs were lost, people were working from home. Zoom became our best friend, and the world waited until it could breathe again. We were told not to hug our friends, that we couldn't hold family celebrations over 6 people. We couldn't even grieve our losses. We couldn't visit our favorite public indoor spaces. We couldn't do the things that relieved the stress in our lives. COVID overtook our world, but it wasn't all that was happening in our lives. It came on top of our usual life challenges and other public issues like Black Lives Matter, residential schools, here in BC, the old growth forest protection, and many other situations. So wow, we were faced with a lot. The effect of all this initially narrowed our world. It separated and isolated us, and it pushed us into our feelings and emotions. All of our senses went on high alert. Swami says, every experience that is drawn through any of the senses has an effect on one's health. And yes, the past 18 months have challenged us, and yes, it has had an effect on us, on our well-being and how we handle life. So these effects can be classified in a bit of a catch-all term, trauma. You'll have heard that spoken more and more. Stress is also another term that's used. So what is it? It's what happens inside of you as a result of what happened to you. So it's your internal response to an external event. And that same set of circumstances will bring out different reactions in people because it's based on your perceptions, your beliefs, and your values. So some people embrace the lockdown. They reduced their social interactions as requested, and they took it as an opportunity to go within and contemplate life, to reaffirm one's purpose and values. Some people cleaned a lot, they learned new skills, they took courses, they baked bread, they started a new hobby, they adopted a pet. And others hunkered down, got lost in the unknown, hoped for a quick end, often waiting in isolation and desperation for a return to normal. So the emotional response or the characteristics of this trauma and stress is varied. Next slide, please, Abby. As mentioned, that emotional response is felt by all, but not in the same way. So everyone adds their personal spin to it. But initially there may be a denial. It was, what is this COVID? It's invisible, it's unknown, we have no data on it. Does it really exist? I don't know anybody who's had COVID, all of those things. But eventually and you may rationalize and minimize your feelings, and day-to-day life takes over. But at some point you start processing it. And those feelings and behaviors that are shown here, they only become an issue when they aren't acknowledged and processed. When you try to stuff it, hide it, the body knows, and it will start. You'll start with the feelings of helplessness, the mood swings, maybe a mental blankness. You could have difficult sleeping, feel fatigue or depressed. And often people aren't even aware of their reactions because they're kind of subtle and they can sneak up on you. They might last only for a short time period while you process, but sometimes it takes a little longer. And friends and family are very helpful at this point because they can draw to your attention that you don't seem to be your usual self. You know, is everything okay? Would you like to talk? So that gives you an opportunity to take notice. So what gets us through of these characteristics that we encounter? What is it that makes it better? And that is resiliency. And again, it's a term that's being used a lot now. And it's the ability to withstand, adapt to, and recover from adversity and stress. So this is what helps you to overcome the situation that you find yourself in. So some of the characteristics of resiliency, and these can also be seen as strategies. Everybody has their coping strategies to exist with the events in their life, the tools that help us get through and to understand the reaction. One of the main ones for our group, of course, is our faith in Swami. He says that anxiety is removed by faith in the Lord, the faith that tells you that whatever happens is for the best and that the Lord's will be done. For us devotees, it sets a beautiful foundation to build other strategies. So we can stay positive in the situation. As soon as you find yourself turning to a negative, like, oh, this will never be over, I'll never see my friends again, I can't even go out my door. Switch your thinking. Suddenly go, well, you know, look at what I've learned this year. Personally, I went through an existential crisis. I came out at the other end going, wow, did I learn a lot about myself? And there's tools there I can apply going forward. Your personal set of beliefs and your faith go a long way. The ability to laugh at yourself, to find humor in a situation. There's still lots of joy. Just go for a walk in nature and you'll just be amazed at what you see. I have a small hummingbird feeder. I'm 16 floors up in a building and the hummingbird's been coming back and forth ever since this talk started. And it's just a little piece of joy, right? And that is something that just takes away any angst that's around. Rely on your social supports. It's really important to keep up your networks. And I know it's harder by Zoom and it's harder when you can't be in person. Make the extra effort. It is well worth it. Face your fears. Once you confront them, you see that really the thought of them is the thing that bothers you the most. The reality, generally, and particularly with Swami's guidance, we can come through this. And know your purpose in life. When you know what you're doing, what you're supposed to be doing, you can stay steady and true on your course. So we thought this brief overview would be helpful to give you some context for when the centers reopen. Devotees will be arriving with differing viewpoints, some with fear as to whether it's safe to come, some with joy at finally coming back together again in person. Some will have experienced unanticipated losses and challenge. Others will be hesitant about the whole situation and always looking for when's the hammer going to fall again. And some will act as nothing has happened. Life is great, everything's wonderful. We would encourage you to have just a brief discussion at the first time that you are back at the center to recognize the challenges of the past 18 months and acknowledge that times have been difficult. Be on the lookout for somebody who's showing signs of stress, where they might be reacting in a way that's not usual for them. Often simply knowing that they aren't alone and that others are experiencing the same thing can help resolve concerns. Swami said, I am in you, with you, above you, behind you, protecting you at all times. Through his grace, may we continue to be resilient in the face of life's challenges. The next slide is just a couple of resources that are available if you want to go further into this area, and suggestion of some things that you can do to help. So thank you. I'll turn it back to Nishi to close.
Sairam, thank you, Patricia. That was a wonderful overview and really put it into perspective of that roller coaster and that transition, and all the different feelings and emotions that many people may have, some more than others, and everybody having different experiences. So I think, we are all, I know we are all anxious to get back to the centers. For many of us, the centers were our beacon of light for our spiritual activities, and they provided a solace for us. But it's very important for us, especially in those in leadership capacities, to really understand what Patricia has just alluded to, is to understand that there's a different psychology of when people have come back after being 18 months away from each other and coming back. People have grown, people have changed, sometimes have gone through more introspection. They are looking at things differently. People have had different experiences. And so the membership will look to us for direction, right? And Swami says, first be. So we must lead by example. We must be calm. We must show confidence in our ability to open the centers. We must show that we've done our due diligence in figuring out what are all the questions they might have, and really making sure we are prepared to open the center before we really open and done the steps, so that when we are first in that position, we're confident, we are calm, and we have understanding, then it'll really give our congregation or the membership a lot of confidence. And certainly we can look at examples through COVID. In Swami obviously is the greatest. Swami is the greatest example. He's always calm, unruffled, and is always happy. So he's very patient with all the things that was happening in his lifetime when we were around him. But even if we look at current examples, Dr. Bonnie Henry in BC was very effective in managing the population to help the province agree and comply with rules. And, I think one of her biggest statements was be calm, be kind, be safe. And that motto, if we're bringing that sense of calmness and kindness and understanding each other, and as we know across Canada, there were tons of posters, we're all in this together, be kind to each other, recognizing that we're all going through a difficult time, but knowing also that everybody may have a different experience. And so very important principles that what has been shown in leadership, such as traumatic events like the pandemic, is to make sure that we have principles of non-judgment, of kindness, empathy, right? And patience. We have to remember that each person has gone, as Patricia said, has gone through a different experience. Some people may have had relatives in India, whole families disappear, have died, have passed away. Some people may have had a significant illness with COVID. Some people may have lost their business. Some people may have lost their jobs. Some devotees have had students enter university who've had a terrible experience. So, but others may have, as Patricia said, it was a beautiful learning time. They did more spiritual work, went inside, less distractions. So someone may be very joyful, and someone may be quite devastated by the last 18 months. And we must understand that. So when someone who was regularly coming to the center doesn't show up, it doesn't necessarily mean that they don't want to be there. They may have anxieties about being there. They may have found a different path towards their spirituality. They might be anxious about coming into our crowd. So we make sure we don't judge them. We have to be really understanding. Swami says, talk about first understanding and then adjustment, then bring them in and see what they're about. So really just bringing that forward, because I know as Swamis, devotees, and leaders, we try to always be loving and caring, but it's just a reflection of a moment to think someone else's different experience than yours. And also to make sure we're also very inclusive. The question about vaccination will come up. Some people have not vaccinated. So that doesn't mean that we treat them differently or not differently. Those questions will become up. We have to be non-judgmental. Everybody may have their reasons. Everybody's going to have a different comfort zone. Someone may still choose to wear a mask if they are vaccinated. They still may choose to wear a mask, and we don't judge them. Avoid the stigma around someone who's had COVID or not had COVID. Many times, in the beginning when people were getting COVID, there was a lot of stigma, especially even in our in the South Asian population, that we were not following the rules. So people attach stigma to those who've got COVID. Oh, that means they didn't follow the rules. So we have to be very cognizant of some of the belief systems that other people, that some of the congregation may have, that they might bring it to you, or you to be aware of some of that stigma and to reduce that stigma so that we bring unity, compassion, and care into the center. And vaccinating, and then remembering, as Brother Avi said, that those who are vulnerable populations, those are the elderly with underlying illness, they may not come back to the center, and that doesn't mean they don't want to be there, but they might have an anxiety of being in a crowd again. People might, when you go up to, hug them, they may not want to be hugged. People don't shake hands anymore, but some people do shake hands. So there's this, I've already noticed it in BC when we're here. Some people are very open and some people are shrinking back, and people do not know how to interact with each other because everybody's wondering, what is everybody comfortable with? So just being aware of that dynamic, and when we're coming across with compassion and understanding and calmness, I think it will give a lot of security and lowering anxiety for the congregation. Next slide. I think the other thing is that at this point, us as a leadership has an opportunity to reevaluate, reset, and reinstate the priorities of the center. The purpose of keeping Swami's teachings alive and the spiritual growth, as well as keeping the needs of the membership at the forefront. So, we've had a big pause in our centers. And so with that, when we have coming back, we can set new parameters for different activities, what is becoming important. And next slide. I think it's very important to look at what are the different avenues we can find out how are those priorities going to be met. Next slide, Abby. So some of the things to consider in re-establishing those priorities and re-establishing, remember that the center is Swami's beacon of light, of spiritual light, to help us all in our spiritual journey, right? And it's not just about the bhajan singing, and it's not just about the SSC, it's not just about the study circle, it's really about, are we able to make this a place where the spiritual needs are being met? So again, in reducing the anxiety for people to come back, and also to make sure that their needs are being met, one of the things that's probably, we've thought of a few things that may be useful in your reopening is to, and these are just suggestions, by all means, you don't have to do any of them or all of them, but again, setting the stage of, we're talking about lowering anxiety and getting people involved again, is looking at maybe a virtual town hall for information, question and answers, so that people have a chance before they come back to the center. They might say, well, how are we cleaning the center? Or are we all wearing masks? Or how is it going to happen if we're vaccinated or not? They might have all these questions. So consider a town hall, so that will lower people's anxieties. Maybe an email of all the things that have changed in your center. Make sure the changes are posted so all are informed. So if we are not having singing yet, we need to post that right now we're still not singing. If we are saying that, masks are still recommended in certain areas, we should post that so that there's no confusion. Confusion and misinformation leads to a lot of anxiety and fear. So the more we can do about being clear on what's happening, then people aren't looking to each other and sort of wondering what's going, how come he's not doing this or how come he's doing that? And it makes it a lot easier for everyone. And then again, we're coming back after 18 months. And so maybe think about how we're going to connect. How are we going to build those connections? Because people have gone through trauma, gone through stress, gone through various difficulties. Consider maybe doing, a welcome committee and volunteers to help, bring people back. How has it been? What can we do for you? Help navigate them, get them knowing the rules and the new rules or new changes that have happened in the center. Maybe, having a little bit of dialogue of what's going on. Some people may be new, they may have been relatively new to the center, a little bit of trepidation is coming back. Think about a survey, what activities would people like to keep? Sometimes now the elderly are so used to having the virtual activities, maybe they want that to be continued, and other people may want it to be continued because they felt much more involved with the centers where they couldn't attend before. And then think about a study circle around, I think this is a really interesting piece that one might want to consider, is that a study circle around the COVID-19. What have we learned? How did we deal with it? What did the changes, what did we know about our own spiritual progress? What are the things that the world was in so much excess before pre-pandemic, and a lot of changes have happened globally. So what did we learn about ourselves and about our world? What priorities? Many people have said, I'm sure you've read articles about, who are the friendships you're going to keep? Who are the people you're going to keep in your life after the pandemic? Because there was a lot of social obligations that we had, but we don't have to keep anymore. So it's the same way is that people are going to reconsider, okay, if I'm coming back to the center, I want to reconnect. Is it important to me? Let's make it important. How are they going to connect? How are they going to stay connected to the center? And how is it important? And then discuss, as Patricia said, stress and resiliency. The center is part of that support system for dealing with stress and resiliency. That's, budgeons and study circle and community. And that's what we can really bring people together and offer support for them. So I think it's really important just again to keep that in the backdrop of being open, non-judgmental, welcoming, and also just lowering the anxieties of some of the people. Some people will be so excited to come back, but let's not forget that everybody has a different experience. So with that, I'm going to end. I don't think I have another slide, do I, Abby? Yes. So with that, we're going to end, and we are going to open the floor to questions I don't know if we have anything in the chat, Abby, or we can open the floor, or Brother Shiva, would you like to start? Is there any questions that you might have?
Oh, no, I think there's a question on the chat already, Brother Samiran. Dr. Avi, your mic, I mean, you're not muted, I think, but maybe.
Okay, so Avi.
There.
Oh, he's
back.
Okay.
Yeah, sorry about that. I was just sharing the screen, so I didn't read through the chat box while the screen was being shared. So there's a question from Brother Samiran that says, will you have a web page to assist us in finding the most up-to-date health guidelines? I guess I'll answer that question. We thought about it. It's changing so rapidly that if we were to make a page, whenever there's updated guidelines, we'd have to be changing the link way too often, and that may actually lead to us having an outdated site. So we won't have a site that has the updated guidelines. However, we can direct you to your local public health unit's website, which should have all the updates posted on there. And then when you're reviewing them, if there's any concern that your guidelines may not be the latest, in that Google form, you can send us a link to what you've used, or you can email us at any time. And we can just double check and make sure you're using the appropriate and latest guidelines.
I think the other thing we might be saying is just to point to that we had talked about this, and what we found is that the updated link, that when we're actually, if we just give you the link, that link changes, right? Abby, that's what was happening, is that the actual link changes from the next update. So that's the challenge. It's not just one link that puts the updates all the time. It's the actual link will actually change.
Yes, exactly. I should have been more clear, but yeah, the link, it doesn't always change. Some provinces use the same link, some of them change, but we just don't want to make that mistake. So yeah. There's another question about in the chat box. Brother Sumerian has a few questions. So one of them is, do we need to wipe down surfaces between each and every person who touches any surface like staircase rails? So again, that will vary from province to province, right? You know, and the public health guidelines do contain this level of detail. So I don't want to make a general statement, because I know Brother Sumerian's in Vancouver, and then it's quite different in Ontario. So I would say, you know, everyone look at those guidelines. They are specific enough, and it does describe what you should and should not be doing with regards to cleaning. And we can always touch base offline about that specific question if it's not found in your guidelines. There's, yeah. Sorry, Nishi, were you saying something?
Sorry, no, I was just reading the question. What to do if we have no HVAC?
Yeah. Any comments on that, Nishi? It's a tough one. We've tried to learn as the medical committee as much as we could have learned about air circulation. So for example, I'll refer to the Ontario guidelines because I'm most familiar with those, being from Ontario myself. They have a great section, and the Public Health Agency of Canada also just put up a great section about air handling and air circulation. And they do go through, you know, if you don't have HVAC, what you should do. So there are other modalities that can be used for air circulation, certain ways of opening windows, using fans appropriately directed, strategies like that. So I can, again, when you're developing your reopening plan, if that's a question you have, send us an email and we can direct you to those resources on what you can be doing if you don't have an HVAC system. But there are alternative strategies. Any comments on that? Does anyone else have any comments on that?
I can quickly add, Dr. Avi, I think in Quebec, there was in schools at least that don't have proper HVAC systems, that they were suggesting sort of these portable filtering devices that maybe perhaps some centers can consider putting something of that form in their budget halls and so forth. Yeah, thank you.
And in those guidelines that I mentioned, there's a section on those units as well, Brother Siva. Yeah. Yeah. So opening windows, is that a good idea given the virus is airborne? So generally speaking, opening windows is a good thing. However, you have to open windows in a certain way that you get appropriate flow. Opening one window, for example, may actually be more harmful than opening two windows where there's flow through the building. So again, that's also outlined in this specific document that I'm referring to. So the answer is you can open windows, it's a good idea, but you have to open the appropriate numbers of windows to ensure that there's appropriate flow. So that's clearly outlined in the document, and I'll definitely share that with anyone who would like to see that reference. So you can read it over yourself and find out exactly which windows are appropriate for opening.
I think the next question is, are we going to share the slides? Sorry, yeah, one is them that we're going to share the slides, and yes, we will be sharing the slides, and I think the presentation Avi, you will post it on the website?
Yes, we're going to get the video up of this presentation, so the slides will certainly be in the video, and then we can post the PDF of it as well on the site. Yeah.
Sister Shushila said that she's basically, if there's any devotees who want a one-on-one for matters pertaining to return to the center, and certainly we are available at any time for anybody who needs questions. We can do a separate call with each center. And as we have over the last 8 months or 18 months that we have had one-on-one sessions with certain centers. So just email us. Generally, we tend to, when we are needing to, we're meeting every week, but generally we're meeting every 2 to 3 weeks. So we can certainly schedule it in at any time and at an urgent basis. If
So we have Brother Prem asking, have you considered a virtual town hall meeting by SSIO for all members and only executives?
I think he meant not only executives.
Oh yeah, not only executives. Yeah, so just general membership at large.
I think we did open it to the general public. I think in the email it was said it was designed for executives, but open to the general. I think Abby and Patricia and I have talked about it, but perhaps maybe in September we could do a general town hall if that's something that's the membership would like. I'm certainly happy to do that. If Brother Shiva, if you think that we need to do that.
Yeah, no, that sounds good. But since Dr. Avi is going to put it up on the website,
Yeah.
certainly once it goes up, we can share that link with all of the centers and they can share it with the membership. And perhaps maybe we just have to sort of make sure that any questions from them can reach you eventually.
Yeah. So maybe we can reevaluate that, and if you feel that we want to do another town hall for SSIO at large,
That's right.
We'd be happy to do that, but I
Absolutely.
don't think that would be redundant.
Oh, Dr. Avi, all I was saying is that because you have done such extensive work, and if the centers that have a medical committee per se in their executive, which I know some centers do, then those in the medical committee can take this presentation and present it to the center at large, and or even in the region. So it wouldn't be incumbent on you for them to do for every center. And again, when we do a town hall, we have seen not so many people are unable to attend, but at a center level, they may choose a date which is really good for everyone to attend, so it'll save. I just thought I'll mention that. I know Toronto York has a medical committee on their executive, which is very helpful. And Dr. Prema Gopi, who is on that medical committee along with our president, Sudhakar, they continually update all through the pandemic. They were doing that, so.
Yeah. Thank you, Auntie. Yeah, that sounds like a great idea. I'm happy to touch base. I know that's a great idea. We can share the slides. I know Prema Gopi, we went to school together, so I know him quite well. Yeah.
I think that's actually an excellent idea, because if they can, Prema can also, talk specifically for Ontario and provide the links and updates for Ontario. So if people do have a medical committee in their region or their center, absolutely, that's the better way to go, because you can speak directly to the community you're in, and certainly we are open to making liaison with those individuals to help them if they need us, but they may not need us.
Okay. We have a few more questions, so I'm just going to move on to the next one. So there's a question about having a door in the center but no windows. Would that pose a risk to propagation? It's a very specific question, and I say let's touch base offline about that, because we'll have to look at kind of the size of the room, what kind of building it is, does it have an HVAC, all these other factors. So certainly we should touch base by email. Please contact us and we'll be able to give a more specific answer on that. I noticed that Uncle Sudhakar has his hand raised, so if he wants to unmute himself, if he has a question or comment.
Brother Sudhakar? No, I guess not.
Maybe let me, yeah, he's not muted, so, okay, we'll move on to the next question. Should we be saying that volunteers who assist in any reopening be double vaccinated? So I know we spoke about this, Sister Nisha. Did you want to touch on that?
Sure. Yes, and this will come up, right? So this will come up. So I think we as a SCI organization cannot make any separate rules, or we don't wish to make any separate rules that is different from the general public health recommendations. So we are a spiritual organization, and from public health standards, we are going to suggest that everybody, each center follows their public health guidelines. So if the public health guidelines in your area suggest that you need to be vaccinated to be volunteer, then that's what you do. Most of them, of course, will be saying that you need to have, you know, if you're not vaccinated, you need to be masked. They will provide those guidelines around volunteers, and each section will have some guidelines around volunteers. But we have to be very careful, as I said in my discussion there, is that we do not want to marginalize anybody or create stigma for anybody. There may be certain reasons why some people are not vaccinated or cannot be vaccinated. And we really want to have an inclusive environment. Obviously, because public health is suggesting that we all be vaccinated, we are going to support vaccination and encourage vaccination, but not to segregate or to you know, marginalize or create any disunity on people who cannot be. And so I think following your general public health guidelines is your best bet, and you'll stay the course and stay safe that way, because the guidelines are meant to protect the community. Avi, did you have any comments on that?
No, that's what I would agree. I noticed that we have to ask Brother Sudhakar to unmute himself. So I've asked him to unmute himself. So if you wanted to ask your question now, go ahead.
He has put his question in chat, Abby.
Oh, okay. Okay. Patricia, did you want to read that out for us?
Yes, I was wondering, can we resume with floor seating, or should we still distance with chair seating?
Yeah. So good question as well. So this is also in the guidelines for each province. So right now it's still, I believe Uncle Sudhakar is Toronto, York, right? So in Ontario, social distancing is still being advised for religious gatherings in when I last reviewed the guidelines. So there should still be distancing involved. In terms of carpet versus chairs, so our stance with carpet versus chairs was that initially you should not use carpet because you can't clean it between cohorts, especially for a larger center like Toronto, York. It's hard to clean carpet as opposed to like bamboo mats or chairs, which can be wiped down. So, you know, using what the guidelines say, I would say it's still ideal to space the chairs out so you can maintain that social distancing, and you can also, it can be cleaned easily between your cohorts of groups coming in. Again, continually review the guidelines, because as we move from phase 2 to phase 3 and so on, those things may change a little bit, but I would suggest still using the chairs for now, spaced by 2 meters.
I think with that as well, you know, and again, different provinces have a different thing. In BC, we have no restriction on religious gatherings with social distancing. But again, we have to look at the center level and comfort zone of people coming in, where we don't have any restrictions with gathering and social distancing indoors. But we may still, as a center, you may still feel that, okay, just to help everybody, we continue to social distance, put the chairs away so that everybody's feeling comfortable. And that may be a transition. And I think that would be a wise thing to do, because we do not have 70% of the population vaccinated yet. And we do not have, you know, the same herd immunity. That will come in the coming months and up into the fall. We'll have to see what happens with the Delta variant. So probably to err on the side of caution and keep following the precautionary guidelines, as we did when we sort of tried to reopen in September. Start slow, start small, and reopen. Perhaps do with, you know, I know that there have been some centers who've been asking us about Guru Purnima, can they open? Again, look at your guidelines. Maybe keep with social distancing with your chairs, keep things comfortable, make them, you know, and so that people also get a sense of comfort when they come in. And then as we learn more, and as we start into September, when we go into the full reopening at different province levels, we can have a better comfort zone. We're all learning in this process, and what we certainly don't want to do is, go right back to at a PSI center level, go right back to doing everything we did, and then have an outbreak in one of our centers. So going slowly, and I think using common sense as well to see our comfort zones. I think there's another question about.
Yeah, there's a question. Did we have a hand as well?
Yes.
It looks like Sister Soumya wants to say something. I'll ask her to unmute herself.
Sairam, everyone. Thank you very much for your presentation. I have one question though. I'm from Victoria, BC, and the PSI Center here, we don't have a center. We usually have the bhajans in people's homes. So I do understand there have been lots of questions around social distancing and mask wearing and everything. So I was just wondering, I thought I'll raise this question because ours is I don't know if it's a unique case or it's a very special case where we don't have a center. So where do you see us in this whole picture?
Yeah. Sister Nishi, do you want to say something, or do you want me to comment on that?
Go ahead, Avi.
Yes, I mean, we've had this come up with a few centers, and the question becomes, do you follow the rules for an individual household, or do you follow the rules for a public space or a religious center? And ultimately, I think, if it's a house that's been completely repurposed as a center, and there have been structural changes and it's only used as a center, I think it's appropriate to follow the rules for a religious place of worship. If it's a house where you have people living in it, as well as also using some space in the house as for center purposes like bhajans or study circles, then I would more likely lean towards treating it as a household, just because of the shared airspace, the shared HVAC system, the shared circulation. So that kind of setup would likely follow the rules of a individual household when you're looking into like gatherings within households. Nishi, do you think that makes sense?
That makes absolute sense.
Yeah, and I hope that somewhat answers your question. And there are, in the guidelines, there are obviously rules that apply specifically for places of worship. And I know BC has guidelines for that. And then there's guidelines for social gatherings in households. So, and they're fairly detailed. So I think by referring to those two documents and seeing where your center fits in, you should have some clear guidance.
Perfect. Thank you so much.
No problem.
Abby, the next question is around currently singing is not allowed in Manitoba. When that changes, what precautions should we start thinking about?
Yeah, so singing is a very tricky one. It's a very hot topic because we know that it increases the risk of aerosolizing the virus, which is making the virus airborne as opposed to droplet spread. So it can actually spread beyond the typical 2 meters. And it's led to several outbreaks in churches and other communities across the world. So, as Sister Nishi mentioned, certain places are changing their guidelines to say there's no restrictions at all. And then certain places will not have singing permitted, right? You mentioned that you're in Alberta. Sorry, Manitoba. I can't remember specifically about Manitoba's guidelines. Did we review any reopening plans for Manitoba? Do you know who the center president is for in Winnipeg or Manitoba?
I think it's Niranjan, right? Is that right?
Oh yes, okay, yes, yeah. So I did have a look at the Brother Niranjan. I did have a look at the Manitoba guidelines, and they do have a section on singing, and when you decide, when it is permitted by Manitoba to reopen singing, the specific guidelines actually mention some strategies that can help reduce spread once singing is re-implemented, such as having additional space between singers, possibly using plexiglass, using certain instruments that are like non-wind instruments, more instruments that are like piano or harmonium, I suppose. Manitoba's guidelines do recommend some precautions. Once singing is permitted, those can be followed, and we can direct you to those precautions if you can't find them. Also, if for whatever reason they aren't in the Manitoba guidelines, there are other provinces, like for example, in the Ontario guidelines, they have a list of precautions that can be taken once singing reopens. Those can also be extrapolated potentially to make it a bit safer in Manitoba. Is that a fair answer?
Yeah, absolutely. And I think, again, I would just reiterate the same precaution to take, even when it is permitted, that we really use singing as sort of one of the later things to introduce. You know, introduce our SSE classes, introduce the study circles, introduce the SAVE activities. And I know how much we all love having the budgeons, and it's so integral and core part of SCI activities. But at the end of the day, we don't want that to be the focal point of getting a community outbreak. And so really taking steps to be cautious about that, because as in the SCI centers, you know, it's not only the lead singers that we can distance the lead singers, but the congregation sings as well. And so you may have to adapt to a different a way, pre-recorded, and then people just listening. You'll have to think about things, but I think, you know, slow and cautious is the way to go until we know more, and we know more about the variants that are coming as well. So would that be fair, Abby?
Yep. Yeah. I've always taken a very cautious approach with singing. I think as the medical committee, we all have since the beginning, because it does come at such high risk. And there's evidence to support that, certainly, that it is a high risk activity. I see Uncle Sudhakar has his hand up still. Maybe it's from before. If you wanted to, did you want to say something or
I think it was from before.
Possibly from before? Okay. I will lower the hand then in that case.
There are a couple of questions from earlier on should we make an exception for children and so forth. So 936 timestamp.
Yeah. So an exception to children. So again, different rules, different provinces. So I'm not sure where this is, province this question is coming from, but and I think we're seeing a lot of questions that are very specific, right? That can really be answered by going back to the local public health guidelines rules. So most guidelines do have a section on children, believe it or not. And, you know, I can answer this question in the context of Ontario. You know, children aren't banned from, or it's not recommended to keep children away, but, you know, the guidelines in Ontario, for example, say children should remain under adult supervision at all times, because children may not be able to follow rules in the guidelines. Also, of course, you know, the guidelines also would stipulate that if there's an outbreak, or if the child has been a contact of COVID-19, whether it's in the daycare or at home, they shouldn't be attending anyways, currently in Ontario, right? So, so to answer your question, like, I don't think children should like be kept away from the center, but refer to what your local health or public health guidelines say, because there is likely a section specifically on children. And if we're talking about Ontario, it's usually that children must always be with an adult, and that if they have had a COVID contact, they should not be attending. But I wouldn't make a broad sweeping change saying that only people above 12 should attend, unless, of course, your local health guidelines stipulate that. But review the section on children in the guidelines for your local health unit.
And I think, again, you know, remembering that when we're returning and when they say no restrictions, it doesn't mean that we let go of any of the good practices that we've had, you know, hand washing, keeping things clean, wearing a mask, maybe if you're not, you know, if you've got a little bit of allergies or something, so that you're just not spreading any droplets, keeping our good practices together. Again, maybe when you're coming to the center, people are not going to know whether they hug each other or not hug each other, we have a beautiful gesture of hello, which is our namaste and sairam. So we should keep that, and just initially as we're coming back, being very cautious about what we're doing, but not creating a sense of isolation. It's that fine line.
Yep.
Okay, there's a couple other questions, Abby.
Yeah,
No,
go
okay.
ahead.
No, good.
No, I think we got them all.
Yeah, I think we did cover all of
There was
that.
one from Brother Sean. Should we suggest everyone fully vaccinated before attending activities when reopened?
Yeah, I believe Sister Nishi addressed that one, right?
Yes.
Okay.
Again, we're going back to our public health guidelines about we can't mandate that everybody has to be
Right.
double vaccinated before attending. We can encourage vaccination for the protection of the community and themselves, but we can't mandate that. And I don't think we have to say one or the other. We have to just say that following the public health guidelines, we're encouraging everybody to be vaccinated, but everybody's welcome.
The one thing that I just want to quickly add is that that should we encourage PSI centers to perhaps maybe have a Zoom call with the congregation to kind of inform them once they've gone through the reopening plans and put all of that in place, of just kind of informing them of what the norms are. Because a number of times you've mentioned about posting what these guidelines are, but I think it would be good to might be good to sort of inform them that yes, this is how it's going to be conducted, and take questions from the congregation.
Absolutely, I think, and that's what I was referring to as a town hall, and maybe I wasn't clear enough, but
Okay, excellent.
Coming back to your centers, talk to your congregation, talk to your members, so that they're fully informed. It'll really create a sense of comfort and understanding and clarity for everybody. Because as we all have questions, just as you have questions, we all have questions. The membership is going to have a lot of questions, and the challenge is two things create anxiety. One is misinformation or lack of information, right? And that's when we have information, when we have correct information, we can then make good choices and feel confident. And I think that's really what the goal of our presentation today was, to really help you understand that piece, is that good information and correct information, and understanding the psychological backdrop.
There is one last question. Are there any restrictions for seniors or various age groups attending centers?
No restrictions. No restrictions. Again, they are at a little bit more risk, and so we have to be careful about that. So again, if a senior, please welcome your seniors, have them come, because that's we have to weigh the risks and benefits. But if they're wearing a mask, even if they're doubly vaccinated and they're wearing a mask, then we should, there's no stigma around that. We should not think that they're not vaccinated or they're not. It doesn't matter. We treat them, and we and be careful around, exposure and what safety, social distancing, mask wearing. Maybe that's their comfort zone, and that's, I think, important to recognize, that we protect the vulnerable in our community.
Yeah, and it's important to know as well, like in your town hall or the information that you share with your general membership, it should be mentioned that everyone has to acknowledge that individuals with health conditions, particularly elderly population, will be at higher risk, even if they are double vaccinated, right? We are seeing cases in the hospitals and the ICU with double vaccinated individuals with health issues because their immune system may be a bit weaker. They may not have mounted a great immune response to the vaccine. So it's not to say that, as Sister Nishi said, that we should not make a rule that certain individuals should or should not attend, but they should be aware of that risk and weigh the risk and the benefit for themselves, and then make that conscious decision on whether to attend or not, if it fits their risk benefit profile.
And certainly, to add to that, that's maybe where a center who has a large number of seniors may choose to continue some virtual activities, because I think that really allows people who cannot attend or feel or are not feeling comfortable to attend in person, really still keeps them connected to the center. And I think you will find, you know, again, across not only religious, but across businesses and across across the globe, we've found that virtual attendance is here to stay for the medical sector as well. It's going to be here to stay because there's a lot of benefit. But again, we also want to continue the in-person because that's a different connection. So we might have to find a nice mix of both.
Mm-hmm. I did want to touch base on Auntie Preeti's question about SSE and, you know, children under 12 have not been vaccinated. We did touch a little bit on children under 12 attending center. I think the question is a little different with SSE, where you have a large number of children gathering with one guru, for example, who may be a bit older, who may have health conditions. It's different than just, you know, a group, you know, youth spaced out in a bhajan or in another event. So according to, you know, a lot of like, you know, SSE group, the younger groups, group 1, they're kind of like, you know, very young, like almost, it is educational, but a lot of it is almost, I don't want to say child minding, but it's a lot of like, you know, they're not to the level where they're necessarily sitting at a desk at all times. They need some hands-on attention, right? And that almost falls a little under the category of childcare programs in some ways. I don't want to say that, you know, the young groups in SSE are like a childcare program, but in some ways there are similarities, right? And in the Ontario guidelines, for example, they say that right now, you know, programs like that should not necessarily be happening at places of worship in person. So specifically for the younger age groups, I would definitely have a look at each province's guidelines. As Sister Nishi said, things are very different in Vancouver, for example. But for the younger group, I absolutely think that should probably remain online, actually, because I think that falls a little bit in a different category than a group 4 class, for example, right? If you think that the service is kind of a little bit more child minding, a little bit more larger number of young kids to one guru, I would think maybe holding that online. But the guidelines of Ontario, for example, they do go into that aspect in a fair amount of detail. So it's a good question. That's why I wanted to touch on it, because it's a subtle difference from just children returning to center.
Yes. Thank you, Avi. And I think that's a very point well taken. And I think we have to be creative in our centers is, you know, maybe if even when we are bringing the younger children back and the children back, is maybe we want to think some of the younger gurus to be teaching them rather than a senior who has maybe a little bit of comorbidities or health issues, not to put them with maybe a little higher risk. So those are the things we have to think about when we're coming back in person. So I do want to make sure that everybody's aware that, again, we are, you know, we're not trying to skirt some of the issues and saying it's on the guidelines. It's just that it's very different in each province. They're constantly changing. There's different links. So we don't want to give wrong information here, and it's being recorded. And then, of course, the information changes. So please do feel free to reach out to any one of us. Or email all of us, and we do meet quite frequently, so we will answer your questions, and usually our turnaround time is pretty quick. But if you can possibly give us lead notice, we would appreciate, you know, a week to 10 days if we can, but if it's of an urgent matter, we will definitely respond. So certainly any of those questions that are particular to your province or your center, or then certainly reach out to us, and we're here to help you. Is there anything else?
Dr. Avi, in that next step, sort of like the wheel that you had showed, was there a deadline for when you wanted PSI centers to complete that form, that online form?
No, we didn't set a deadline, and we did that intentionally because every center will be planning to reopen at their own pace.
Okay. Okay.
So whenever you feel comfortable, if that's, in the coming 14 days, then submit it. But if it's,
Okay.
you may not open till October, then submit it then.
Okay. Okay. Sounds good. Thank you.
Okay, I think I only put this till 7 o'clock, so I hope it's not timed out. But anyways, I think we've answered the questions. Certainly, when we are going to be, from what we gather, people may have Guru Purnima, one or two session openings, but the general consensus, what we're seeing is that people will maybe think of reopening in September, but one or two off events for Guru Purnima or any other events may be happening. So please do submit your form so that we know, and we will inform Brother Shiva as well on which centers are reopening, so that as an organization we're well informed. And as Brother Avi mentioned, and I'm just going to reiterate that point, is that it's mandated by public health that we have a written reopening document. So public health can come at any time, and they've come to restaurants all the time. They can come to any place of worship at any time and ask for that document. So please do have that before you've reopened. We do want to be in compliance with public health guidelines. Well, if we don't have any other questions, then maybe Sister Preeti, would you just close us with Om? And Brother Shiva, is there anything else that you'd like to say?
Oh, nothing, but just thank you so very much. Wonderful, wonderful presentation from Sister Prishisha, Dr. Avi, and Dr. Nishi. Thank you.
Thank you. Thank you very much. Thank you.
Thank you so much. And our gratitude to beloved Bhagwan for having such dedicated and devoted medical team led by Sister Nishi and Dr. Avi and Patricia. I think it was very, very well put together, along with the psychological effect and impact. Thank you, Bhagwan, for bringing us all together, and may we continue to serve you in our most loving manner. May you give your blessings for health to each and every one here and beyond in the families. Let us chant the Loka Samasta prayer, and as we chant, there are a lot of our Sai family members ailing. May we embrace them in our prayer. Om Samasta Loka Sukhino Bhavantu. Samasta Loka Sukhino Bhavantu. Samasta Loka Sukhino Bhavantu. Om Shanti Shanti Shanti. Jai Bolo Bhagwan Shri Satya Sai Baba Ji ki Jai. Thank you.
Thank you, Saram, everyone.
Sai Ram. Sai Ram.